Now let's talk about stroke. Stroke is very different from a heart attack because we're looking at blockage of the injured person. There may be a blood vessel or an injury that has caused the collapse of a blood vessel or a blockage. So we're going to treat stroke differently than a heart attack. We don't want to give the patient anything by mouth. You don't want to give aspirin trying to thin out the blood. And you want to make sure that you know what you're dealing with. Basically, when you see somebody with stroke, there's some indicators that you can normally find. When you're speaking to them, you may see that one side of their face tends to drip or drool. There may be drool. Their muscle, basically the muscles can shut down. Sometimes one eye will be drooping or blinking, one will and one won't. You can have them raise their arms, and if you see that one arm starts to slump even though they're trying to keep them up, all these are indicators. They may be very confused, they may have slurred speech. One thing that we need to ensure though, when we're dealing with someone with a stroke, they may not be able to actively speak back to you. You may be asking them all kind of questions. They most time can understand what you are asking them, but because of the muscle damage, they cannot respond. So you're doing this a disservice to them by continually asking questions. What you need to do is be aware that they can hear you. You, as the responder, are making sure that you're controlling their airway, their breathing, their circulation, monitoring their vital skills. And of course, as always, you should have already initiated the emergency response. You're going to basically just stay with this patient, provide care, watch over them until emergency services arrive.